Yes, sir.
You mentioned you'll be having additional services as the need is determined. How will you determine that? Will you be asking those who attend to fill out the form, or what will you be doing there?
Okay, sure. That's a fair question. The question is, how will we determine when there's a need? What we're looking at right now is that there are services we do not provide, but we feed them out to the community. You may have a cardiology appointment and we send you to the cardiologist, we pay the fee for the cardiologist, and then you bring the report back. And what we're doing is aggregating that data to find out what are the services that most often our veterans need in this area that we're not providing. Those are the ones we're going to provide first. We think that the demographics of the veterans are going to change over time. And what we want to do is to be sensitive to when these needs are occurring and to be able to provide the service. But we also want to make sure that we don't provide services that we really don't need. So if we find in our analysis that we use a cardiologist half-time, then what we'll be doing is looking at either hiring a cardiologist half-time, using fee services, or a consult service.
Transportation provided for patients who have a hard time getting back and forth?
Okay, the question is, will there be transportation for patients who have a hard time getting back and forth? We have several transportation systems that are available. The DAV has a fairly large transportation system. They are currently transporting in this area. That will continue. We have a veterans transportation system that Jim Dalkowski, who's in the back, who's our Associate Director for Operations, has been managing to help provide some of those transportation needs. We're also going to be depending upon the City of Wilmington to help us look at bus route times and what's going to make sense for the hours of the clinic and what the needs of the veterans are going to be. And then also for staff, because we know that some staff are going to prefer to ride the bus. Now, one of the things I did not mention, and I probably should, is that there's going to be lots of parking. Lots of parking. And I know we're challenged at our current site with parking because we have another tenant upstairs, and sometimes that becomes a bit of a challenge. And if you look at the space, you'll see that there is a lot of opportunity for parking out there, and we're really excited about that. Yes?
I've been reading about a lot of innovative care going on in other VAs for PTSD and TBI using biofeedback and other leading-edge technologies. Are any of those envisioned for this clinic?
Our mental health staff have been utilizing a number of techniques to help various staff groups. And we envision that those evidence-based practices will be used at this clinic. Now, there will be some circumstances of the veteran that we can't provide that care there. Someone who is a traumatic brain injury, who has not had an opportunity to have sufficient rehab, may have to have another step before we're able to help. But everything we provide is going to be evidence-based, and we're going to provide as best that we can to the population that we have.
Well, they're already doing biofeedback at several of the other VA centers around the country. So is it your understanding that biofeedback is evidence-based?
I'm not a mental health provider, so I would have to defer to our mental health providers for that answer. But let me assure you that we have a very aggressive mental health program, and we also are now working with East Carolina University with looking at training programs that will be affiliated with the VA so that we'll have an additional opportunity for evidence-based practice. Other questions or comments? Yes, sir.
The doctors that you will have there, what will be their longevity? Will they be there for 5 years or 1 year?
You know, the question is, how long will the doctors be there, 5 years or 1 year? I wish I had a crystal ball. That's hard to predict. There are providers who, by their very nature, like to work in a location for a couple of years and then move someplace else. There are others that say, this is where I want to be, and I'm going to be here for a very long time, and everything in between. What we're looking for is the best possible providers to take care of our veterans. That's what we're looking for. And realizing that using the PAC system I talked about, the patient-aligned care team system, will provide us with that continuity. Should a provider leave, the other members on the team know the patients and can continue with the therapy and then help the new provider to become acquainted with those patients. I mean, I wish I could tell you they all would be there forever, but I have to tell you that human nature is such that we know some will be moving around.
You don't rotate them out?
We do not rotate them out, no. No. The only rotations that you might see is with medical students and residents. And we do anticipate we will have some of those there. They will rotate just by the nature of their training program, but we will not be rotating permanent staff. Other questions or comments? Yeah.
So the current PTSD meetings, will they be housed at the facility now?
The question is, will the current PTS meetings be housed at the facility? The answer is yes and no. We will have groups for PTSD at the facility, but there are also some evidence that peer groups held outside of a medical facility may also be advantageous. So in those circumstances, they may be located elsewhere. We want to, again, be evidence-based and see what's best for our veterans. But we do anticipate we will continue to have PTSD groups at the site. Yes? Other questions or comments? Yes, ma'am.
Are you going to be contracting with other local vendors to complete the continuum of care that this clinic will provide for the veterans in the community? For example, will you contract locally, right here in Wilmington, with certain organizations or resources? I know you guys have contracts in Fayetteville, and you guys really stick to those providers, but are you going to open it up so actually the veterans can have services from their local area?
Okay.
Well,
There's a handout that, where's Robin? Robin has a handout, and on the back of the handout, there are two sites that I want to call to your attention. One is USA Jobs, which is the site that we use to advertise positions that are open when they come open. And that's what we will use for Wilmington, is that when we have single positions that are open, it will be posted there. We expect that'll start probably in September, and individuals can apply. Now, for those services that we feel it would be better to use a fee-for-service or to use a consultative type of service, we will be using that through a contract, which is, if you look on your handout, www.fbo.gov, which is contracting opportunities. So we will open that up for contracted services to those that we feel that we need it. Yes,
Josh, I was wondering, I found a lot of care through yoga, and they've been doing a lot of studies, and there's a lot of programs for yoga for veterans, and I was wondering if there's going to be a facility or if there was a way that maybe the VA has been thinking of getting outside source, one of the outside sources for yoga.
The question is, has the VA been thinking about outside sources, such as for yoga? We use a number of modalities. For example, at the Jacksonville CBOC, they're using WE for therapies for mental health patients, as well as for some of our geriatric and for physical therapy. So we are embracing that. We have used yoga at Fayetteville. The problem at Wilmington is that we didn't have any space for it. And now that we're going to have a PT-OT gym, we'll be looking at a number of modalities that will be available to our veterans. And yoga may be one of those.
And now in that, would you be hiring a veteran, like a veteran yoga instructor? If you have a veteran and a non-veteran, would you hire a veteran before they get preference or what?
I will always hire the best qualified person.
specialty clinics, zeroing in on hearing aids. That's not been mentioned. Is that likely we could get checked out for the need of a hearing aid and it would be ordered here and fitted here?
Thanks for mentioning that. Let me tell you two things. Absolutely, there's going to be audiology that will be available here, not only to adjust hearing aids, but also for hearing examinations. So both of those will be available in the new clinic, yes.